Hi, friends, and welcome back to the program. Right now, we have a most compelling segment to show you. Unfortunately, cancer has become a way of life. It's either in your family, or you have friends, or you know someone who has been touched with this vicious disease. And of course, I'm thinking about my partner, Linda. And I sincerely, Linda, I hope you're home watching this because, sweetheart, I found this segment to be very inspirational and very uplifting. You're going to see a piece of space-age technology that there are only 10 such machines in all of North America, and we have one of them in Buffalo. It's been with us for a month now, and I visited CCS Oncology and talked with two amazing doctors who are directors of the Oncology Center on Spindrift Drive. And this machine, the TrueBeam STX, is going to allow them to locate and treat cancers that were heretofore untreatable because they couldn't be reached. They can now. When I walked in the room with this machine, I thought I'd walked onto the set of Star Trek. I mean, it was very impressive. CCS Oncology on Spindrift Drive. That's where we were, and I urge you to stay with us and watch this. Well, good morning, everybody. John Summers here. You know, we live in a world where war is all too common at any given time. Any number of wars going on across our planet, some long, some short. But there's another war we've been involved in longer than perhaps anyone can remember, and that's the war on cancer. Well, thanks to CCS Oncology on Spindrift Drive in Williamsville, our side took a giant leap forward with the TrueBeam STX system, which allows doctors to locate and treat tumors more effectively, more efficiently, and faster than previous methods. Matter of fact, I understand it can treat cancers that were thought untreatable in the recent past. I'm with Dr. Wonsam Yi right now. He's director of the facility. Doctor, thank you for being with us today.
You're welcome.
This is truly an exciting moment. I almost feel like we're standing at a defining moment in history with something like this. Can you tell me a little bit about the background of this technology?
Sure. This is the most advanced tumor targeting system that's available in the market. And this is one of 10 machines that are installed and up and running in the whole country.
Wow. How long has this technology been with you in this location?
Roughly 1 month.
1 month?
Yes.
So it really is new.
It is very new. It's cutting edge technology. It is indeed the state-of-art cancer treatment. We can track the tumor real time, and we can adjust the beam according to the tumor movement.
I understand it does all of the things that the previous methods up to now, the gamma knife, the cyber knife, tomography, tomotherapy.
Yeah, literally we can target any tumor, any size, anywhere in the body. So we can treat all types, all stages of cancer. And it does it with such a high precision, so that causes less normal tissue toxicity, but at the same time we can deliver higher dose of radiation that is considered to be curative.
I understand the beauty of it is that the treatment is so much quicker than previous treatments. I mean, it cuts the time down a great deal.
Yes. Like some systems, literally patients may have to be on the treatment table for more than an hour. With this, definitely most treatment will be done less than 10 minutes.
Oh, that's amazing. That's wonderful. Doctor, does technology like this replace chemotherapy? Does it work in tandem with chemotherapy? Or I don't know.
Yeah. Yeah, definitely. We really work with our surgical oncology colleagues and medical oncology colleagues. This is not intended to replace any other types of treatment modality, but it gives added option for our patients.
Now, some time ago, I heard about some kind of technology that would allow doctors and technicians to make the beam conform to the shape and size of the tumor, but this probably goes beyond that, doesn't it?
Yeah, I mean, this really takes to another level. In terms of beam shaping, we call that in radiation oncology. It has the smallest leaf blocks, so that allows our doctors to shape the beam and shape the dose. Really, we can literally paint around the tumor contour.
And this allows you to do this with such effectiveness that it's not harming anything around the tumor itself. It's really going after the enemy only.
Well, it really cuts down unnecessary radiation to the surrounding tissues and organs.
Yeah.
So we really expect this system to be able to eradicate tumors and cancer cells throughout the whole body without causing significant radiation-induced normal tissue toxicities.
Doctor, in the press release, it said this was effective in some cancers that recently were considered untreatable. What would be a form of cancer that we thought maybe some time ago was untreatable that can now be treated?
For example, a lot of times, we see patients come to us. For example, their cancer started from the lung or started from somewhere else in the body, but it went to the liver. And the liver is the organ that moves up and down and moves around quite a bit with patients' breathing. And with this system, we can really track the tumor movement and in the real-time fashion so that we can give the very precise amount of radiation dose to the precise location.
This is truly remarkable, just absolutely remarkable. What is the average length of treatment time if you had to give what we call a ballpark time? Everyone's going to be different, but what would be the average time?
I would say less than 5 minutes.
Less than 5 minutes. And what did it used to be?
It used to be, longer than that, 10 minutes or longer.
Okay. Well, this doesn't have any residual or after effects after treatment?
That's why we specialize in radiation oncology, especially for those tough, challenging cases. And all of our doctors are board certified and experienced in treating all types of cancers and different body organs. So we really try to minimize any radiation-induced side effects.
Doctor, we thank you so much for your valuable time and for your cooperation and allowing us in to see this amazing piece of technology. And I feel like someday I'm going to be able to say I was standing there with Dr. Yee on that day when we unveiled this thing. This is just truly remarkable. Thank you very much.
We're really excited about this new system. I think it really brings a new hope through new technology.
I think so too. Thank you, sir. Folks, take a look at the screen on how to get in touch with CCS Oncology on Spindrift Drive in Williamsville. In the meantime, please stay there. We'll be right back. Yes, you'll find CCS Oncology as soon as you turn on to Spindrift Drive off of Main. It's in the first building on the right-hand side on the ground floor. Very easy to get to. After the segment, I told Dr. Yee, I said, Buzz Aldrin will always be able to say, I was on the moon with Armstrong. And I said, someday I'm going to say I was with Yee at the True Beam. I was that impressed, and I hope you were too. So if you are suffering from cancer, if you know someone who is, I urge you to have them contact CCS Oncology and find out if they might be the answer that you've been looking for. Stay with us. More of the show is coming right up.